To Sri Lanka now, which is one of the countries hardest hit by the cost of living crisis. It's now unable to pay its international debts, and people are facing huge prices when it comes to essential goods from food to fuel, but now also vital medicines as well. Archana Shukla reports from the capital, Colombo.
This insulin shot thrice daily is critical to Gina's health. But recently it costs 3 times more, and the medical bills now take up half of the family's monthly budget. Gina's sister Farida, who runs the house on her meager income, is struggling to make ends meet.
Even the transport and diagnostics is expensive. Gina had to skip her full medicine course last week as we didn't have $12 to pay at the private pharmacy. We are not even having all 3 meals.
Medicines to treat heart ailments, antibiotics, and even life-saving cancer drugs, almost all imported, are costlier by 40 to 100%. Across Sri Lanka, some patients on long-term treatments have now been forced to skip their vital medications because they cannot afford them. Even those who can afford them, these medicines are often not available. I've met multiple patients who've told me they are running from pharmacy to pharmacy, scouting for their prescription drugs. Once acclaimed, Sri Lanka's free public health system has come to a standstill. Pharma companies have curtailed imports too, owing to currency fluctuations. Fuel shortage accentuates this supply glitch. Sometimes not even a single vehicle is available to transport existing stock. Mark Martinez is the country manager of a firm importing cancer drugs. He's struggling to manage orders for patients in dire need.
Sometimes we are unable to cater to the shortage because when the hospital goes out of stock, we import a very small quantity for the private sector, especially cancer products. When they have to take it on a cycle basis, sometimes it gets interrupted. They have taken a 3rd cycle, they have no medicine to buy it for the 4th cycle. Hospital doesn't have it, private sector doesn't have it.
Desperate calls for supplies are flooding social media, amplified by focused groups as citizens take matters in their hands. Sri Lankan diaspora is flying in supplies to patients and doctors, even as the government seeks more emergency aid to avert a healthcare catastrophe. Archana Shukla, BBC News, Colombo, Sri Lanka.